Up next we have the lovely Katy Oates, and she is going to be presenting on mental illness and drug abuse.
Hi, my name is Katy. I'm going to be talking about mental illness and drug abuse. I became interested in this topic because I went to work with my mom actually, and she works at a mental health hospital and she decides whether the patients stay in the hospital or not. And I saw all these people come in, and all of them had mental illnesses obviously, but pretty much all of them were also there because they had abuse disorders, they abused drugs. So I realized that there was a link between these two, but I didn't know what it was, and I wanted to understand this more. So, why do so many mentally ill people abuse drugs? And also, what can we do about this problem? So first, mental illness. Mental illness is any kind of disease of the brain. It can really affect a person's thoughts, actions, or personality, and it can severely impact their functioning in daily life. How common is mental illness? About 30% of the general population has some form of mental illness. It's more common in younger people, and it's also more common in women. Schizophrenia is one of the major forms of mental illness. It is very severe. It can severely impact a person's daily functioning, and it causes hallucinations. It causes people to believe that someone is controlling their mind. And they can do really crazy things like walk out into traffic or leave the stove on and let their house burn down without even thinking about why this could be a problem. Another more severe form of mental illness is bipolar disorder. Bipolar disorder causes huge mood swings. Obviously we know that, but these mood swings can last for extended periods of time, like months. And in these mood swings, a person can be happy, they can be motivated, or they can be depressed. Okay, so drug abuse. Drug abuse is the repeated action of taking any form of drug, abusing it, taking it for purposes other than it was intended. Two of the main drugs that have correlations to mental illness are methamphetamine and cocaine. They can induce psychosis, which is seen as a form of mental illness, or they can trigger early onsets of mental illness, like schizophrenia, which usually doesn't emerge until later in life. 60% of people who have a mental illness also abuse drugs, and 60% of people who abuse drugs also have a mental illness. So why is this so common, and why is this such a huge problem? The problems of these two diseases in combination are just amplified. The effects of mental illness are so much worse when a person takes drugs as well. So a person who has schizophrenia who also takes drugs, they're more likely to be violent, they have severe hallucinations, and they're also just so out of daily functioning that they're not going to be able to hold down a job or have a successful life. So these are some celebrities that have mental illnesses: Kurt Cobain, Marilyn Monroe, and Jack Kerouac. Kurt Cobain and Marilyn Monroe both had bipolar disorder, and it really actually helped their careers in a way because they were more creative, they were able to be motivated and produce amazing artwork. But they also were distressed. They were depressed from their mental illness, and they took drugs to ease this problem. And both of them had severe drug issues, and they had premature deaths. Jack Kerouac had schizophrenia, and he was an author, but he was also very creative because of his schizophrenia, but it led him to alcoholism, and he had a premature death as well. So clearly this is a huge problem. But why? Why does this occur? The biggest problem is self-medication. People with mental illness don't understand what is happening to them or why they feel so sick or alienated from the rest of the world, and they take drugs because they have no other option. They use it as an outlet to relieve their problems. Besides self-medication, stress, genes, and trauma are the biggest causes of mental illness and drug abuse. Stress, like huge amounts of stress, like such as your parents getting divorced at an early age, that could lead you to have a drug problem, but it could also cause you to have a mental illness. And genes can cause both as well. You can have a predisposition for addiction, and obviously your mental illness is most likely genetic. And childhood trauma is also a big factor. Early exposure with all three of these is most important in causing these problems. The earlier that someone is exposed to stress, trauma, they are going to have bigger problems later in life. So what can we do about this problem? Integrated treatment is the biggest option and the most successful. Integrated treatment incorporates services for drug abuse and for mental illness. It provides people with these problems doctors from both aspects, so people that can help them with their addiction and people that can help them with their mental illnesses. And this is actually very successful because it allows them to have a more convenient solution and provides help for both problems. There are a lot of problems with this though. One of the main problems is that it's very expensive because a lot of these people are very poor and they can't afford this kind of treatment. And another problem is that it's not convenient because they basically do have to live in a hospital. They can't function in daily life. And it's also not widely available yet. It's just not been researched very much and it's not very common. So what can we do to help these people? Well, a lot of people would say that the problem is we need to crack down on drug trading. We need to prevent drugs from entering the system, and that will help these people. They won't be tempted to use these drugs. But this isn't really true because the people are going to find another drug to use. They're not just going to use an illegal drug. So what we really need to do is make integrated treatment more available to these people, and we need to provide better care and better doctors for them. Thank you.